Welcome to Clinician's Notebook by Doc Athena. This is a Country Vet's Technical Diary 21 for free. Today, we are going to discuss case number 002, FLUTD or feline lower urinary tract disease in cats.
What is FLUTD?
Now let's proceed to case presentation.
FLUTD is a complicated case being a collection of different conditions that could be associated with different causes.
Feline lower urinary tract disease or FLUTD is one of the most commonly reported feline diseases, basically because it is one of the reasons why cats are being brought to animal hospital. It usually breaks the family-pet bond because of the behavioral changes brought by this disease. FLUTD is actually a complicated disease which is usually a collection of different diseases. Because of this, there had been an increasing interest and research about this disease which showed radical changes about its causes, prevalence, and pathophysiology. With this, according to Gunn-Moore's study in 2003, it shows that recent studies revealed that FIC or feline idiopathic cystitis happens to be the most common cause of FLUTD, which is contrary to the previous publications which gave more focus on crystals and stones. So what are the risk factors for FLUTD? It could be age, inactivity, gender or sex, neuter status, breed, or stress. Well, of course, when it comes to age, older patients are more predisposed to this condition. For inactivity, indoor cats are more predisposed because of lesser exercise. And that also is related to their neuter status because intact cats tend to be more sexually active. For diet, cats that eat dry food seem to be more predisposed to this condition because of the lack of fluids or water in their body. For sex or gender, males are more predisposed to this condition basically because of the anatomy of their urinary tract. Their urethra is smaller as compared to the female urethra. Breed, it may or may not contribute to this condition. The stress, concurrent diseases, or other environmental factors might contribute as well in the development of this disease. However, further research is needed to check or to verify if this is really a contributing factor in the development of FLUTD. So what are the clinical signs of FLUTD? It could be dysuria or stranguria, hematuria, or periuria. It could be all of this, or it could progress from one sign to another. These signs, however, resolve within 5 to 7 days spontaneously. However, it might recur. Now, the patient might look apparently healthy, but the condition could be worsening. And that's the problem. So I would advise that once you observe any of these clinical signs in your pet, please bring them to the hospital to be properly and clinically evaluated by your veterinarian. Now let's proceed to diagnosis. Since FLUTD is a complicated disease, there is no pathognomonic test or diagnostic procedure that could distinguish this disease from other diseases. However, practitioners with exposure and expertise on urinary tract diseases could narrow down their differential diagnosis with the help of different diagnostic procedures such as cystocentesis, urinalysis, abdominal radiograph, CBC, and biochemistry. So these are the tests that your veterinarian might suggest in order to narrow down their differential diagnosis and arrive with a proper diagnosis when it comes to urinary tract diseases. Now let's proceed to treatment. There are two treatment options. One is surgical and the other is medical. For surgical, your veterinarian could perform exploratory laparotomy and/or cystocentesis. For medical treatment, your veterinarian might discuss with you the use of fluids, laxatives, supplements, and immunostimulants, of course, that is to improve the condition of the patient. Also, broad-spectrum antibiotics might be used to combat secondary bacterial infection, and also anti-inflammatories will be used to address the ongoing infection or inflammation with the patient. So, in summary, FLUTD is a very complicated disease that could be caused by several urinary problems. Being a complicated disease, there is no pathognomonic diagnostic procedure that could distinguish this disease from other diseases. For treatment, we could do surgical treatment or medical treatment. Now let's proceed to clinical presentation.
For the abstract, a 1 year and 5-month-old intact male Siamese cat was presented to the hospital on August 3, 2010 with a chief complaint of dysuria. The cat was kept indoor, fed with whiskas in can, and given with water every day. Laboratory test results showed marked leukocytosis. Radiographic findings included deviated urinary bladder on the left side in ventrodorsal view. The patient was prescribed with multivitamins and mineral supplement to be given 5 inches SID as supplement, bisacodil 5 mg tablet to be given SID for 5 days, pineapple juice diluted with water to be given ad libitum, and clotrimazole 480 mg per 5 ml suspension to be given 2 ml BID for 14 days. The owners intentionally failed to comply with the prescription. Exploratory laparotomy revealed enlarged bladder filled with hematuria. The blood vessels were engorged and the bladder wall has irregular surface. Manual aspiration of urine was performed via tomcat catheter. The patient was given with 0.4 ml marbofloxacin and 0.5 ml dexamethasone.
That's all, folks, for our clinical discussion from Clinician's Notebook by Doc Athena. I hope to see you again in our next lecture. For those who have not subscribed yet in our YouTube channel, please do so. And if you have any questions, please leave them in the comment below. Or if you want a private conversation, you can send us a message to Doc Athena Facebook page. Please keep safe, everyone. God bless us all. Bye!